The academic journal I chose is the Nephrology Nursing Journal. My field of study is nephrology. Nephrology is the study of anything pertaining to the kidneys, like its function and treatment of malfunctioning kidneys. The journal I'm publishing is for the Nursing Nephrology Journal. Their focus is to help inform those who are planning to become nurses of nephrology or those who are already nurses of that field, to inform them about different situations that occurs in that area or enhance their nursing skills. The Nephrology Nursing Journal helps inform or educate nurses and or future nurses about kidney disease so they can be able to tackle any obstacles that may derive from kidney disease. Their journal is highly detailed when explaining other people's conducted experiments. With that being said, most of their articles are informative and research synthesis based. The journal is pure of observations and research along with illustrations of data, facts, and logical statistics. Language tends to be complex at times, but the authors tend to clarify or elaborate what they mean. This is also found in descriptions under charts and tables. There have been several occurrences where authors keep clarifying on the same subject, making it feel like they are repeating sentences over and over, but just in a slightly different way. So the journal writing conventions they used were highly detailed, engaging, and they used research-based questions. Usually they are like the questions they face like in situations of nephrology, and their main claims are usually found in introduction, and the format they use a methodological format where they tend to explain how they conduct the surveys and to whom they conduct them to. Uh, they mostly write research synthesis papers, and they use a problem solving compare and contrast type of organization, and their thesis statements are usually found in the introduction or abstract. The journal writing conventions continued. The journal uses observational and research support by using facts and statistics found in charts and tables. They use a chronological style. Rarely are there any counter arguments found, but when they are, they're usually found in the discussion page. Research is found in APA format. They use interviews and secondary research from other studies, and although they tend to elaborate on the charts and graphs, it's still hard to understand. The journal writing conventions continue. It's almost required that you have an educated sense of anatomy and physiology in order to get what they are talking about in their journal. They have an intellectual and professional persona. They use a formal tone, which means that they don't use contractions. Language is a bit complex, mostly because it tends to be medical terms. Analysis is given in the third person. Sentence and paragraph length is not too long. Explanations and observations tend to be long-winded because they elaborate on what they are discussing, which is a good thing. I planned to write an informative and explanatory synthesis paper on how peritoneal and hemodialysis affects kidney failure patients physically, mentally, and socially. This issue is relevant to fellow scholars in my field of study because investigating what is underneath this issue may help provide more information which can hopefully lead to possible solutions that can try to cope or control the physical, mental, and social problems peritoneal and hemodialysis patients go through, in some cases on a daily basis. Additionally, many suffer from kidney failure, and so it is only right that we provide patients as such with an abundant variety of information as we try to care and support them. The writing conventions I used were a research synthesis type of organization, a compare and contrast organization, in which I compared peritoneal and hemodialysis patients' QOL levels, quality of life levels. I used facts and statistics as support and secondary sources from my research, and I used an intellectual persona as well as a professional one. I used an informative analysis organization and a formal tone, which means I did not use contractions, and a somewhat complex language style. I used medical and anatomy and physiology type of language. I used a third person style, not too long sentences, although with the elaborations I didn't end up having long sentences. With that being said, I used an elaborate style. The subtitles were also found in my paper. I separated the introduction and the body paragraph into three sections, which were the physical and mental and social paragraphs, and even smaller ones from there. And I also separated the conclusion into a subtitle. I chose to use these writing conventions in order to meet most of what they require in their journal, so it can feel consistent to what is already published. The writing conventions I did not use were charts and graphs. I felt like it would confuse readers if I put the charts and graphs in there rather than actually helping them. I didn't use an engaging style. It was kind of hard to use an engaging style because all I did was state the facts and statistics of peritoneal and hemodialysis patients, quality of life levels, and I did not use a APA format. I wanted to focus on my MLA format instead. And as far as the methodological and chronological and interviews part of the conventions, I felt like it would be hard to incorporate in my paper. But overall, I chose not to use these writing conventions because I did not conduct my own experiment. I just gave an informative research analysis. One of the sources I chose was the Saudi Journal for Health Sciences. The article title was Quality of Life Assessment, a comparative study between hemodialysis and peritoneal dialysis. Safa and his colleagues provided a comparative analysis, and they conducted a cross-sectional study in which PD and HD patients took the survey, and the responses were measured in a 0 to 100 range. The other source I chose was Quality of Life Research. The article title was Quality of Life and Emotional Distress Between Patients on Peritoneal Dialysis versus Community-Based Hemodialysis. K. Grieva and colleagues attended universities in Singapore. They conducted a survey and provided a comparative analysis. They measured the QOL levels of peritoneal and hemodialysis patients as well, and used a 0 to 100 range to score the responses. The other source I chose was the Journal of Clinical and Diagnostic Research. The article title was Comparison of Outcomes and Quality of Life Between Hemodialysis and Peritoneal Dialysis Patients in Indian ESRD Population. Vikas Makar and her colleagues attended universities in India. They provided a comparative analysis. They didn't really get into detail of like statistical information when comparing peritoneal and hemodialysis patients' QOL levels. they mostly commented about it. The other source I chose was the International Journal of Nursing Practice, Quality of Life in Chronic Hemodialysis and Peritoneal Dialysis Patients in Turkey and Related Factors was the article's title. Bessie Oren and Noray provided a comparative analysis and measured the QOL levels of peritoneal hemodialysis patients, and they based this on a 0 to 100 range as well. The other source I chose was the Renal Failure Journal. It's actually two articles. The first one was titled The Impact of Nutritional Status, Physical Function, Comorbidity, and Early versus Late Start in Dialysis on Quality of Life in Older Dialysis Patients. The authors were Karen Enger and her associates. They provided comparative analysis and measured the QOL levels as well, like the other sources did, of PD and HD patients. They based this on a 0 to 100 range as well. The other one is titled Quality of Life in Peritoneal and Hemodialysis Patients in China. They had different authors in the previous one. The authors were Fin King Wu and his colleagues. They provided a comparative analysis as well and measured the QOL levels of PD and HD patients and based this off of 0 to 100 range as well. The purpose of this informative explanatory synthesis paper is to provide a comparison of PD and HD patients' physical, mental, and social health using data from 6 different studies conducted by medical professionals. Peritoneal dialysis or hemodialysis are formed as a type of treatment and may be, in some cases, the only treatment to help the kidneys function as patients try to embrace the fact that they are at the end stage of renal disease. Among the surveys that were conducted to PD and HD patients by professional practices, their main goal was to compare the results from the surveys into a detailed analysis discussing the similarities and differences that of PD and HD patients by analyzing their QOL quality of life. Overall, peritoneal patients have better quality of life when it comes to physical, mental, and social health, according to the gathered data from 6 different analysis studies. Here's a visual of what PD and HD patients go through. In the blue arrows, the bad blood is moving into the dialyzer and is being filtered into clean blood, viewed in the red arrows, and this affects PD and hemodialysis patients' physical health, mental health, and social health. Around the world, there are many people who undergo dialysis. Seeing that this is the case, that means many people's quality of life is getting altered due to their treatment. Helping these patients get the best quality of life may enhance their survival or just enjoy life like those without kidney failure. Every dialysis day they have to endure affects their quality of life, and making life better for these patients will not only help them but also help those around them as well. These people include those who assist on their dialysis treatment and, most importantly, their family and friends. For patients who have low physical function to move around and visit friends but want to maintain their social mental function, family and friends should try to visit them instead. Also, those who assist in their dialysis treatment whenever there is free time should embark in a conversation, comment, or compliment their patients as often as possible to boost their social or mental function. Family and friends and assistants should try to motivate their patients to move around or exercise with something so simple such as playing with the stress ball in order to get their physical function levels higher. If nothing is done, not only will these patients have a poor quality of life, but they also may have lower expectations to live. If all is done, these patients may have a better quality of life and hopefully live longer and stronger.